So chances are you have looked at a movie star and thought, I would really like to have that Hollywood smile, especially if you're watching this video series on smile makeovers. Well, a bright, natural smile boosts self-confidence and it shows off your personality. But today I'm going to show you exactly how we select the right shade for you instead of just something that looks brighter. Most all patients say they want something brighter, but let's get into the specifics of exactly how we do that right after this. Dr. Rouse here, and welcome to the channel where we try to demystify dentistry using technology. And after 15 years of doing smile makeovers, one thing I hear over and over again is if I'm getting my smile done, I want it to be brighter and I want it to be lighter. And whatever word you want to use to describe it, today my point is I'm going to show you how we select exactly what that shade will be so that it goes well with the rest of your face. The things that you want to avoid, the things that you want to do, so that you get the right shade that looks like you, but also looks brighter. So let's get into it now. All right, so one of the main takeaways for today is called the shade guide. That's what I'd like for you to think about when you leave this video, the shade guide, and each one of those teeth on there are called the tabs. So a shade tab, and we use these for anything from a crown to a bridge to an implant crown. And for dentures, there's a lot of uses for shades and shade guides, but this specific shade guide, one of my favorites, called the Vita 3D shade guide, has all of the additional shades for bleached teeth. So if we're looking at veneers, we're usually going for something that looks like you've bleached your teeth. You want it baked in so that it looks like, wow, I'm going to have that forever. So you're going to look like you have bleached teeth, but you're not going to have to keep bleaching your teeth. The veneers are made that shade, right? So this is an easy way to hold these up and show you like a little battle of the bands. Do I like this shade better or do I like this shade better? And then we end up just going back and forth until we find the perfect one for you. The main thing to think about is it is a lot easier to take a bright color and tone it down with the veneer cements than it is to take a darker veneer and try to brighten it up with a veneer cement. So that's the main thing. Piece of advice that I have for you there. And then the other one would be looking at the whites of your eyes. So typically we will not just hold the shade tab, the individual shade tab up to your teeth. We will hold it up to the whites of your eyes and then try to make sure we find something again that goes along with the rest of your face. So not just looking at your teeth, but also looking at your whole face is really what a smile makeover process is about. It's different than just doing one tooth at a time. We're trying to have something that goes with you. And so we look at everything from the neck up when we're talking about doing a smile makeover. And I definitely have a couple of shades that I tend to prefer. I know that every dentist may have, every dentist that's doing cosmetic dentistry probably has their own opinion on different shades. But I have a couple that work well for me. This is definitely something you should think about to be specific more than just, I want my teeth to be brighter, for instance. So, and then my last tip here is that one of the things that we really do in our office, and I really encourage you to do, is to get photos with that shade at the records appointment with a camera, a high quality camera, something that has good lighting, good situation in the office. Sometimes a dental light above a dental chair is not the perfect light source for finding out if that's the right shade for you. And so we tend to take a lot of photos, a lot of videos to make sure that we're choosing the correct shade when it comes to what we want the final veneers made out of. So that's my last piece of advice about shades in terms of what you do during a records appointment. The last thing I'll say is a lot of this goes out the door if we're talking about somebody who has severe staining that's not from coffee, tea, years of their diet, anything else playing a role in it. Some people are congenitally born with very discolored teeth. or they lived in an area that used well water or something like that. In that instance, you're definitely going to want to go with something that's more opaque and something that's lighter color, because we're trying to combat what the person came in with in the first place. I'll say that's more of a on the fringes use case than it is the majority of people, but it does exist. So keep in mind that if you have that type of situation, then you're definitely going to want to find somebody who is used to doing those type of cases and how to block that out so that the veneers at the end of the case look spectacular. I mean, they can make for some of the best after pictures, but during the shade selection, most everybody will agree that we need to use some type of material that is not very translucent. Please make sure, if you do have that case, to watch our video on translucent veneers as well. That is it. So the perfect veneer shade, as I've said in some other videos, is the one in which you look like the best version of you. You look like the best version of you that went on vacation. You came back, you look rested and relaxed, and when you smile, people are like, wow, you look awesome, but it doesn't look fake. And so you definitely want to make sure that you find a professional that you can talk to about what shade you would like, but that can show you the different shade selections so you yourself can make this decision. Don't go too crazy with the shade, and also never go too dark, because if you do, then it is almost impossible to try to lighten up the color later on. I would highly recommend sometimes that you take as much time as it needs during the records appointment to look at that shade, really be certain when you leave that that is the shade for you. When we do our process, as I've said before, we do the temporaries as well. So on that day, we take a look at it and again compare that to the temporaries and say, is this the shade that we selected? Let's compare it to the temporary shade that we have on there. Is that something that's going to make you happy? And most patients have a second shot at it, and they can say like, yes, this is definitely me. I really, really love it. And I mean, 99% of the time, I am on the same page as my patients anyway. And so even if I don't like it, I will definitely let you know. That's about it for this video. Again, it's a huge deal to patients. It's a huge deal to me, but it's only one of the criteria. If you'd like all the rest of the criteria, please click the link below. Get that free ebook about how we do thoughtful planning and thoughtful smile design at our office. And if you're in the DFW area, please contact us if you're looking to get started with your own personalized smile. And join us in the rest of these videos. Give us some ideas for future videos. And as always, keep smiling.